Hello, everyone. I'm Lisa Klein, and I'm with the Career Expo Committee. And this morning, we're going to talk about the health sciences and the medical field. And I have two speakers here with me, and they are each going to share with you information about their position, how they got there, and then we'll talk about additional information of jobs that are available, where, what classes you could take in high school and so on. So we'll start with Amanda. Amanda, you want to begin?
Sure. Good morning, everyone. My name is Amanda Rosinski. I currently serve as a supervisor of clinic operations for Advocate Aurora. I manage much of the Two Rivers Manitowoc market. A little bit about my career journey. I started back in high school, did a job study work, started as a CNA. I was a CNA and then I was an LPN, RN, charge nurse, supervisor, manager. I worked 18 years at ThedaCare, all in the med-surg realm. When I graduated with my master's degree 2 years ago, I wanted to try ambulatory nursing. And so I went out to Fargo, North Dakota, Minnesota area, where I managed 14 primary care clinics and some walk-ins. And then prior to the pandemic hitting, coming back here to the great state of Wisconsin, I took the position with Advocate Aurora as a supervisor. So I have had a lot of different experience that has helped to make me a better leader along the journey, and just a great run of it. So that is a little bit about me. The current oversight that I have is I oversee some family practice clinics as well as some urgent cares.
Thank you, Amanda. Next, we have Tina. Tina, are you ready?
Yeah, I'm ready. Hi, my name is Tina Last. Just want to say thanks for having me today. I look forward to working with our younger generations to try and build a nursing force. And a little bit about myself is I work at the Holy Family Memorial Medical Center in Manitowoc, Wisconsin, where I work primarily as the medical surgical floor as a charge nurse. And I also work the floor as well. And I also work casual in the wound clinic. I'm a certified wound nurse. I have lots of experience. Started out as a CNA, like Amanda, and worked up, got my associate's degree in nursing at Lakeshore Technical College, went on and got my bachelor's degree from UW Oshkosh. Became certified in wound care through the National Alliance of Wound Care. And I also own and operate 2 CBRFs in Manitowoc County, where we serve our developmentally delayed population, those with dementia, mental illness, and I also do some crisis as well. So those individuals who are in need of immediate assistance to take care of whatever crisis they might be experiencing at any given time. I also have plans to, add another 60 beds. I'm developing a campus. I'm in the works right now with continuing to build that business of assisted living. So those are kind of the things I do now. I also teach. I am an adjunct instructor for Lakeshore Technical College. I enjoy the aspect of teaching, so I do that as well. So that's background.
Guys.
Thank you, Tina. So since we have a little difference here, I'm going to ask Amanda to talk about some jobs that people have in addition to what you've already shared in the hospital setting, in the clinic setting. And then Tina, when she's finished, if you could add in information and jobs available when you're working in the assisted living, because we have students that work in both of those facilities. So Amanda, can you take it away on that?
Yeah, so careers or jobs available in the, I did 18 years of my career within the hospital. So much like Lisa described, CNAs are oftentimes an entry-level position, very, very needed and helpful. It helps to build a great foundation to launch your career. You can get experience in being able to see what that inpatient setting feels like, also nursing homes. I did work in a nursing home for a little bit as well. So there's the CNA role. An LPN is a practical nurse that is prepared usually at a technical college. It usually takes about a year to a year and a half to earn that degree. A registered nurse, you could get your associates, and then there's the BSN level preparedness. Each rank or step comes with a little more added responsibility and different tasks that you would complete. You know, the main registered nurse overall oversees a patient's plan of care, is working with doctors and their other colleagues to care for a team of patients, that sort of thing. In the clinic setting, we function a little bit different. So inpatient is very acute. You have very acute patients, sick things, lots of going on, but your turnaround is really fast. You know, your patients usually are admitted and discharged within a week's time unless you have a critical illness occurring. In a long-term care setting, that's where those people reside. So you're going to care for those people over a span of time. In the clinic setting, we utilize MAs, which is a medical assistant, some CNAs, as well as LPNs, and we have a few RNs, but their role differs greatly because it's not necessarily acute care. It is more of a scheduled care basis. So we're working on optimizing getting patients in and out of the clinic for routine care things like medical wellness visits or your annual physical with your physician, those types of things. So they vary greatly in the different tasks that you compose and carry out each day, as well as with the type of experience that you would receive from working in a facility.
Thanks, Amanda. I have a question for you that some of the students might have, and that's what are the big differences between a CNA and a medical assistant, an MA?
CNA and an MA. So I believe that how an organization may use them, it really depends. You know, we have to be very careful when we have positions that people are working within scope within healthcare. So the level of preparedness and the education that you have, an MA maybe can do a little bit more. A CNA is going to be easier for you to obtain school-wise. You can probably get into some programs even now and do like a work study. The pay, there's some pay differences between the two. So scope and pay are probably the two biggest things. As far as tasks, you know, I didn't experience working with MAs within my acute care setting. We primarily utilize CNAs, so they did basic things like bathing, assisting the nurse, activities of daily living, so helping to walk patients, toileting patients, cleaning them up, helping to reposition, obtaining vital signs, things that they were trained to. On the clinic side, we utilize medical assistants to room patients for our providers. So they'll go to the waiting room, obtain that patient, get some basic weight and vital signs, and complete the rooming portion of that visit. So ask some preliminary questions and prepare for the doctor to come in and see that patient. So CNAs, typically where I've seen them in my career, but healthcare is the one thing about it is it continuously is changing. It's a very dynamic and fluid field. So I've seen CNAs used more in the hospital setting and MAs now in more of my clinical setting.
Okay, great. Thanks for that information. Tina, could you share with us information about the employees that work in assisted living and CBRFs?
Sure. So residents that reside in either a CBRF setting or an assisted living setting is kind of the same thing. The big difference would be like the size of that setting. So when people say assisted living, you think this big long-term care facility building, or you can also have a smaller setting, a CBRF setting. So I have a smaller setting where it could be anywhere from maybe 8 beds to 24 beds, would be kind of small to medium range. The nice thing about assisted living and CBRFs, it is long-term care, but you're trying, it's the same thing, I guess, in long-term, but you're trying to keep that resident functioning at their, maintaining that level of abilities to complete their ADLs, or actually increasing those. So we rely heavily in assisted living and CBRFs on our CNAs and our resident assistants to provide care and be our eyes and our ears. I guess entry level into the field would be, you would have to be if you weren't licensed, you could start out as a resident assistant. And basically you're a person that comes in, or you could be a personal care assistant. I've heard them called piece, that as well. But you come into the facility, you are helping individuals with cares that require a little bit of assistance. Maybe they need help getting a TED hose put on, or maybe they need help just washing up or bathing, or feeding, or whatever they might need. So that would be the entry level into the field. The next step, if you wanted to further your education, would be to obtain a CNA license, or a certified nursing assistant. What that requires is you generally take a course. A lot of the technical colleges like LTC and NWTC offer a nursing assistant program. That program is usually, they do have accelerated programs, but it's generally 8 weeks to 16 weeks, where you do course room and lab, where you learn skills, and you have to take exams and do like checkoffs for certain skills. And then once you successfully pass that course, you have to go on and take a state exam. So you have a written and a practicum that you have to complete and satisfactorily pass. And then you obtain a licensure. So then you become a certified nursing assistant. So they have a little more responsibilities. They can perform a few more duties than a resident assistant can. They help with, they can use sit-to-stands and Hoyer lifts, and they can transfer residents. They can do all kinds of things like that. And if they have additional training, there's 4 other courses you have to take to work in a CBRF setting or assisted living setting, which would be your medication administration if you were to pass medication. So that would be like a med aid. And that's a 2-day, I think about 8 hours a day course you have to take. And then you have to pass an exam as well, and a practical portion of that as well. So that's, I said there's 4. So there's med administration, standard precautions, which is another, I think 3 to 4 hour course that you take. Fire safety is about 2 hours of training. And then the last one is, what's the last one I'm missing? First aid and choking is the last one, which is a couple hours as well. So, because these people are going to be feeding our residents. So if, a resident would start to choke, you have to be able to perform the Heimlich maneuver and things like that, or provide first aid until the paramedic could get there. So in these facilities, not always is an RN on staff. So generally speaking, you have maybe an LPN or an RN that oversees the whole facility. But if there's a case where they're not there, the CNAs would be, calling or trying to make these phone calls or whatever. So you start as an RA, you can do a CNA, you licensed practical nurse, a registered nurse. So that's kind of the different jobs that would be available. Or you could work in administration or like a human resources. So there's lots of different avenues for assisted living.
Thanks, Tina. For the students, if you don't know what a CBRF is, that's a community-based residential facility.
Mm-hmm.
Sometimes they look like large homes. Sometimes they are built to, as Tina said, handle up to 20, 24 beds. So sometimes there might be one in your neighborhood and you might not even know it. So we talked a lot about nursing and CNA. Tina, you mentioned administration, human resources. Do you, either of you have any knowledge of positions like in radiology or X-ray, any of those? I know students tend to look at digital imaging as one of the areas. Amanda, you're shaking your head. Do you have any input you could give us?
Yeah, so on both sides of the spectrum, so in the hospital, there is also a need for, there's sometimes assistance that I've seen used within our theta care facility. I can't say that it's widespread everywhere, but they had people that would help to transport, or were doing like a work job study to obtain their degrees in imaging, that sort of thing. So on the hospital as well as the ambulatory side, there's a series of roles. I'm unfamiliar or uneducated to what the education path looks like or how much schooling is needed, but I do work with a director of imaging, and I have imaging techs and other things that are within my facilities. And so they are definitely an integrated part of our care team. And another facet in which we work together to serve patients. So they exist on both sides of the equation, hospital and outpatient. I just don't know how much schooling or the various ranks associated with that type of role.
Okay, thanks, Amanda. Tina, do you have anything to add about that?
I really don't know a whole lot of what's entailed with the education portion of it. No, I'm sorry, I don't.
Okay, well, at this point, since we mentioned education, let's talk about what kind of classes could students take while they're in high school? What can they do to prepare to go into the medical field? I'll let that to whoever wants to jump in first.
Sure. So any of your sciences, get really ingrained with your science and your math courses, anatomy and physiology, higher level math things. Communication, oral and written communication is very important. So there oftentimes are, you could do job studies or that type of thing. You could work with a guidance counselor if you are deciding that you want to go into a health field. They may have agreements with various colleges. I started with that CNA program and transitioned over and did that through my senior year of high school, which launched my healthcare career. So my recommendation from my personal experience would be sciences and maths. Build that foundation because it's going to be extremely crucial, and get more of it while you are in that side of the equation. College courses are, they can be tough, so study hard. Don't be afraid of failure. I shared in another session that I did, I initially failed my A&P. So I think that you have to have a thirst for learning, and you can't be afraid to fail. Some things are hard, but you just have to keep trying. And if you put in the effort, you will succeed.
Thanks, Amanda. Tina?
Yeah, I agree 100% with Amanda. Your science and your math courses and your your speech courses, things like that, public speaking. The other thing, if you're thinking about healthcare, whether it's radiology or whatever, really, if you're interested and you want to kind of dabble a little bit further, you could take the nursing assistant program. I think it's great because it teaches you how to properly transfer people. It teaches you how to interact with that patient or that for the first time. So you get a lot of benefits from that course as well. It's that entry level into the field. So
students, another thing to be aware of with the medical field, as Tina just mentioned, getting that nursing assistant and the CNA, the youth apprenticeship program is a perfect opportunity to get involved in the medical field. Youth apprenticeship allows you to get your CNA license and take the class, get your license, work on a job, attend school part-time as you're working part-time, and also take related instruction. So you may get some LTC credits through that if you're in the Lakeshore area or other schools. So talk to your school counselor or your YA coordinator about youth apprenticeship. It's It's a great opportunity to start in the medical field. At this point, I'm going to ask you, what do you like, Amanda and Tina, what do you like about your jobs?
For me, healthcare is just so fascinating. It's ever changing. When I served as a bedside nurse, I loved educating and helping my patients to become the best that they could be and to recover and to manage their disease processes. Now that I sit in more of a leadership role, one of the greatest things that I love and enjoy is watching my direct reports grow and blossom. They are ever changing and helping them to be successful and reach the goals that they are wanting to achieve, as well as ensuring that we are delivering on our healthcare promises and taking the best care of patients possible. So making an active difference, not only in the patients that I privilege to serve, but as I help to grow and groom my staff and those people that are following me. It is such a rewarding experience.
Thank you. Tina, you want to add anything?
Sure. I guess I just like the fast pace, the ever changing, no days like no 2 days are the same. I love precepting new nurses and I also like being able to independently grow a business as well. There's the opportunities are really endless in the field of healthcare. And as you get in it, and there's so many different avenues. If you can start in this department, move to this department, and just really learn a lot of different things. So I think it's awesome field to get into, and there's definitely a need.
Thank you, Tina. So at this time, I think we're going to wrap up. And students, if you have any questions about the medical field, talk to your advisor at school or your school counselor. If you are interested in a job shadow, there are different ways that we can make that happen. In the medical field, there's a number of Zoom programs that we can get you connected with to watch, to learn about different areas in the medical field. Most of you probably thought that medical is always clinic or hospital, but as Tina explained, it can be entrepreneurial. You can start your own business and be running your own business in the medical field also. So there's lots of options, and we've only covered 2 little pieces of it today, much more to come. So thank you, everyone, and have a good day.